Hello, massage nerds. Today I'm going to bring you the Gluteus Maximus and how to do some trigger points and I'm going to show you how to drape also and how to work it, a few techniques. So let me show you that, this is a sensitive area with people. So you want to make sure that you are keeping them covered. Ask them to undress to their level of comfort. What I like to do is I like to put my hand like at their waist to hold right here that nothing undrapes further than that. And then I kind of pull the sheet in and I tuck. Make sure you tuck in at the thigh. You never want to go in close to the groin or even here. You want to tuck in at the waist. And if they are wearing their underwear, then they can you can tuck it in like that. Okay, and tuck in at the waist, never near the groin area. Okay, so once you have your client uncovered, then start palpating. Palpation. You might want to warm up your hands a little bit. It's very important for you to, palpate gently. Find the posterior superior iliac spine right here, and then the sacrum, the edge of the sacrum. The gluteus maximus originates from the posterior part of the ilium, the sacrum, and all the way down to the coccyx, all the way down to here. So all of these is the origin. Origins are closer to the midline. Insertions, 75% of the fibers insert to the IT band, and 25% of the fibers insert on the gluteal tuberosity of the femur. So it's very important that you work the origin and the insertion. And look at the IT band. If the IT band is tight, it's going to pull on the glute. If the hamstrings are tight, it's going to pull on the low back. Also, the sacrotuberous ligament is part of where the glute originates, the sacrotuberous ligament and the SI joint. So you've got to make sure and work this out. The trigger points, the most common trigger points are right here by the SI joint. Let's see. I'm going to palpate. Her SI joint is like right here. So the trigger point is usually, one of the trigger points is here. This one also refers down, this trigger point. And then the other two trigger points are about right here, right. And you can palpate gently to find them. And I'm going to show you that right now. I was just showing you more or less, one of them is right by the SI joint, and then two are down here, like by where the fold is. So you want to make sure and do some kneading to begin with. You can go down the IT band. After you've warmed it up, remember you warm up the tissues, and then you start working the actual muscles after you've warmed it up. So you can do some figure eights right here with your knuckles, or you can also do some spreading apart. This is your strongest, look at my hands now. This is your strongest hip extensor. Your strongest hip flexor is the psoas major. So this is the opposite. This one extends your hip. Can you extend your leg for me, please? See, this extends the hip. This is the strongest extensor of the leg. And this is one of the movements is where you can pin right at the SI joint and have your client extend. So this would be an active move. So do that. She can do that two or three times, where she can extend her hip and it'll start releasing the origin. One more time. Okay, drop your leg. And then the next one, I'm going to show you another one where you put a pillow. Like for me now, it's hard for me to lift their legs, so I would put a pillow underneath here. So let me get that real quick. Okay, so now I'm going to get a pillow. If you can't lift up the leg and you just want it hyperextend the hip a little bit, okay, lift up your leg for me real quick. And then you can put the pillow back there and see that automatically, puts her hip at extension. Remember, this is the strongest, the gluteus maximus is the strongest hip extensor. So this is an extension. And if you are strong enough that you can hold the leg here and pin and stretch here at the SI joint, you can go all from the SI joint to the iliac crest, even close to the sacrum, but do it over the sheet. So, and then you lift up their leg, you know, and down. And then again, move an inch down, lift and down. Move down another inch, lift and come down. So this is a good pin and stretch. Another one that you can do is after you remove the pillow, then you can put her, this is what I call the frog, right here, where you do the leg hip extension here. This is great to work the IT band. You can use the forearm. This is excellent. I don't want to use too much oil here because I don't want to get it all over again. But you can do some great work here on the IT band. You can lift and separate the fibers. Lift and separate the fibers. Lift and separate, lift and separate, all the way down by the knee. Remember that the IT band keeps your knee in, you know, so several muscles attach here. You can use you can separate, do a soft fist, like you're folding a taco, soft fist, and then go from the medial part and then out. Separate the fibers. You can move all the way up to the gluteus max. You can even do this to the gluteus max. You're going to try to move this muscle as much as you can. So this is a great way to get here to the greater trochanter here, the hubcap of all the insertions, also of the deep hip rotator muscles. But make sure that you can work this out. You know, every part of the gluteus maximus. These fibers are tight. This is a very strong muscle. And putting the muscle on extension right here really helps. And I want to show you too, like this is a large muscle. So you could use this big you know, tool right here, even to use it for the trigger points. So let's say we're going to go to the SI joint trigger point right here, and I can press with this so my thumbs don't get tired. You press, and I kind of do a circular motion. There is no evidence of why, but going into a circular motion heals and releases the trigger point a little bit faster. Probably because everything in the world is usually round. So you can hold it from 10 to 20 seconds and then release. And then you might want to go down here to the other trigger point, and you can palpate. Let's just assume that I found it right there. You can press and hold for 20 seconds and then release. And then you can go to the other trigger point, which is approximately here at the insertion, at the gluteal fold. The other two are almost right at the gluteal fold. So you would also hold and press this one here for 20 seconds until they completely release. And then you go back again. You can do some figure eights with your knuckles with a soft fist. You can do some nice petrissage and effleurage. Look at my hands, now they're completely purple. You can also use forearms, you know, make sure you push with your legs so that you don't hurt your back. I'm pushing with my legs, rocking back and forth. You can do cross fiber here too, because the IT band is actually very difficult to loosen up. It's a very tight band. So you can do some cross fiber here. And the last one that I will show you is you always want to assist by the knee. You grab the ankle and the knee, and then you bring their knee back. You can also pin and stretch here. This is another one for external rotation, internal rotation. So you pin and you stretch back and forth. And this is really good to loosen up the origins. And then you can move your hand or your fist, or you can also use your palm. If you're strong enough, you can use the palm going all the way around. I like to use my fist because it's a little safer for my hand. So you do internal and external rotation to loosen up the origins of the glutes. You can also do it at the insertion. You can really feel the trochanter there. At the acetabulum, moving in and out, internal and external rotation. Moving 1 inch at a time, from medial to lateral or lateral to medial. So those are some of the techniques that you can use. And then, of course, you want to finish off with some nice effleurage and some nice cross fiber, the ocean waves here, and to get some relaxation back to the muscle by doing some even of the nerve ending strokes. Remember that what you're doing is you are training the nervous system to relax that muscle. So it's very important for you guys to remember that you don't go beyond the tolerance level of the client. Now I'm going to show you sideline, so that will be part 2.